CareSense InPop, the smart, stylish, pocket-sized blood glucose meter. Meet and experience the most advanced blood glucose meter with various features. With no coding technology, measuring your blood glucose level is easy and accurate. It has minimized the pain of withdrawing blood, needing only 0.5 microliters of blood sample for accurate testing. It takes only 5 seconds for a fast and accurate measurement. Up to 500 test results can be automatically stored, and you can systematically manage your diabetes with the PC Care Blood Glucose Data Management software. It is available to test your blood glucose from alternative sites of the body. Enjoy the portability of light and pocket-sized CareSense InPop. CareSense InPop operates with two 3.0-volt lithium batteries. When the meter is turned off, push and slide the battery cover to access the battery compartment. Insert the batteries with the plus sign facing up. Push and slide in the battery cover tightly until the tab clicks into place. Please confirm that the meter turns on properly by pushing the S or arrow button. In order to use all the smart features of CareSense InPop, appropriate settings are required. In order to manage your diabetes well, correct time setting is a must. Push the S button for 3 seconds when the meter is turned off. After all the features appear on the display for 1 second, the meter will display set. The meter will display year settings by pushing the S button once more. Please set a correct year by pressing the arrow button. Numbers will rapidly change if the arrow button is continuously pressed. After setting the year, press the S button to go on to the next selection. When the number indicating the month blinks, press arrow button to set the month. When the month is properly set, press the S button to go on to the next selection. Use the same method to set the date and press the S button once more to go on to the next selection. CareSense InPop provides 2 formats of time settings: 12-hour format, AM and PM, and 24-hour format. Press arrow button to choose 12-hour format or 24-hour format. After setting the time format, press the S button to go on to the next selection. Press the arrow button to set the correct hour. Then, press the S button once more to go on to the next selection. When the minute blinks on the display, set the correct minute with the same method. After setting the correct time, press the S button to go on to the next. You may choose on or off by pressing the S button. The meter will beep in the following instances if set to on. If the sound setting is off, a mute symbol appears and all sound functions are switched off. After setting the sound function, press the S button to go on to the next selection. CareSense InPop allows you to turn the strip expiration date indicator on or off in this setting. When EP blinks on the display, press the arrow button to choose on or off. Press the S button to save the setting. In this stage, only strip expiration date indicator function can be set. Expiration date setting can be done after all the settings are completed. After setting the strip expiration date indicator function, press the S button to set the hypoglycemia indicator function. The meter will display hypo and the hypoglycemia icon. The meter displays on or off by pressing the arrow button. When on appears on the display, press S button to set hypoglycemia level. Press arrow button to set an appropriate hypoglycemia level within the range of 1.1 to 3.3 millimole per liter. Press the S button to complete the setting. Please refer to your healthcare professional's advice before setting the hypoglycemia level. If you do not want to set the hypoglycemia indicator function, press the S button when the meter display is off. Then, the display moves back to Setting the Year. In all setting modes, pressing the S button for 3 seconds designates the meter to store the current data and turns the meter off. When the strip is not inserted, press arrow button for 3 seconds to set the PP2 alarm. After displaying PP2, alarm, and on, the meter will automatically switch to memory check mode. The meter will display alarm if it is on. In order to turn off the PP2 alarm, press the arrow button for 3 seconds. After displaying PP2 and off, the meter will automatically switch to the memory check mode without alarm. Strips must be stored in its original vial, and it should be handled with clean and dry hands. Strips pulled out from the vial should be immediately used, and the vial should be closed right after removing the strip. Discard expired strips for accurate measurement. If you have turned on the strip expiration date indicator at the setting stage, in this stage, you will be able to set the strip expiration date. Strip expiration date is marked on the strip vial or box. Meter will display all features and then EP when pressing both arrow and S button at the same time for 3 seconds. Press the S button to set year. If the year blinks, press the arrow button to set the correct expiration year. After setting the year, press the S button to set the month. Set the correct month with the same method, and press the S button for 3 seconds to turn off the meter. Do not use test strips past expiration date. Expired test strips must be discarded. You may confirm that the CareSense InPop works properly by using the CareSense control solution. You may do a control solution test in the following cases. Gently insert the test strip into the meter with CareSense In logo facing up until the meter beeps. Please be careful to not bend the strip when inserting a test strip. In a moment, the meter will display a blood insertion symbol. Before using the control solution, gently shake it 2 or 3 times up and down. Always discard the first 1 or 2 drops of the solution before control solution testing. Wipe the tip of the bottle with a clean tissue or cloth. Apply a drop of the control solution on the top of the cap. Apply the solution to the tip of the inserted strip until the meter beeps. Control solution is then automatically inserted. Confirm whether the confirmation window on the strip is fully filled. The meter will display the result after counting down from 5 to 1. Compare the result displayed on the meter to the range printed on the test strip